CEN Prep Test. Question 1. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A. Administer 4 fluids. Option B. Obtain a urine pregnancy test. Option C. Prepare for immediate surgery. Option D. Assess for signs of hypovolemic shock. The correct answer is option D. Assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra-minus abdominal bleeding. Assessment of vital signs and signs of shock are the priority. 4 fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 2. Which laboratory finding is most specific for acute myocardial infarction? Option A, elevated creatine kinase -MB, CK-MB. Option B, elevated troponin I. Option C, elevated myoglobin. Option D, elevated C-reactive protein. The correct answer is option B, elevated troponin I. Cardiac troponins, troponin I and T, are the most specific biomarkers for myocardial injury because they are found exclusively in cardiac muscle. Troponin I is not found in skeletal muscle, making it highly specific for myocardial infarction. CK-MB, A, is elevated in cardiac injury but can also be elevated with skeletal muscle damage. Myoglobin, C, is early but nonspecific. CRP, D, is a marker of inflammation and is not specific for me. Question 3. In a mass casualty incident, which patient would be classified as green minor, according to START Triage? Option A. A patient with a fractured femur, respirations 20/min, pulse 100, able to follow commands. Option B. A patient with an open fracture of the tibia, respirations 24/min, pulse 110, able to follow commands. Option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. Option D. A patient with a large scalp laceration, respirations 22/min, pulse 100, confused. The correct answer is option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. In START Triage, green minor, patients are those who are walking and have minor injuries. The sprained ankle patient who can walk is green. Fractures, A, B, are typically yellow delayed. Confusion, D, is a concern and may indicate need for more urgent care. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient refuses treatment and wants to leave the ED against medical advice. What is the nurse's priority action? Option A. Let the patient leave. Option B. Notify security. Option C. Assess the patient's decision-making capacity. Option D. Restrain the patient. The correct answer is option C. Assess the patient's decision-making capacity. If a patient wants to leave AMA, the nurse must first assess whether the patient has the capacity to make informed decisions. If the patient is alert, oriented, and understands the risks, they have the right to refuse care. Notifying security, B, is only if the patient is a danger. Restraints, D, are not appropriate for a patient with capacity. Question 5. A patient with diabetes presents with a blood glucose of 550 mg/dl, serum osmolality of 320 mosm/kg, and a serum pH of 7.35. What is the most likely diagnosis? Option A, diabetic ketoacidosis, DKA. Option B, hyperosmolar hyperglycemic state, HHS. Option C, hypoglycemia. Option D, lactic acidosis. The correct answer is option B, hyperosmolar hyperglycemic state, HHS. HHS is characterized by severe hyperglycemia, greater than 600 mg/dl, elevated serum osmolality, greater than 320 mosm/kg, and absence of significant ketosis or acidosis, pH greater than 7.3. DKA, A, presents with acidosis, pH 7.3, and ketones. Hypoglycemia, C, presents with low blood glucose. Lactic acidosis, D, has normal glucose. Question 6. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A, hypokalemia. Option B, hyponatremia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option A, hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 7. A patient is receiving packed red blood cells. 15 minutes into the transfusion, the patient reports chills, flank pain, and shortness of breath. What is the nurse's priority action? Option A, slow the infusion rate. Option B, stop the transfusion immediately. Option C, administer diphenhydramine. Option D, notify the provider. The correct answer is option B, stop the transfusion immediately. This patient is experiencing signs of a possible transfusion reaction, chills, flank pain, dyspnea. The immediate priority is to stop the transfusion, keep the 4-line open with normal saline, and notify the provider. Slowing the infusion, A, does not stop the reaction. Diphenhydramine, C, may be given but after stopping the transfusion. Question 8. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A, administer 4-lorazepam. Option B, assess for head injury. Option C, obtain a stat CT scan. Option D, perform a detailed neurological assessment. The correct answer is option A, administer 4-lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 10. A patient with acute ischemic stroke arrives at the ED 2 hours after symptom onset. Which question is most important for determining eligibility for thrombolytic therapy? Option A, what is the patient's blood pressure? Option B, what time were the patient's symptoms last known to be normal? Option C, does the patient have a history of hypertension? Option D, what is the patient's family history? The correct answer is option B. What time were the patient's symptoms last known to be normal? The time of last known normal is the most critical factor for determining eligibility for thrombolytic therapy with TPA. The window is up to 4.5 hours for select patients. Blood pressure, A, is also important but the time window is the primary determinant. History of hypertension, C, is relevant but not as critical. Question 11. A patient is experiencing acute panic attack. Which of the following is the most appropriate nursing intervention? Option A. Administer lorazepam immediately. Option B. Provide reassurance and remain calm. Option C. Place the patient in seclusion. Option D. Encourage deep breathing and mindfulness. The correct answer is option B. Provide reassurance and remain calm. A calm, reassuring presence is the first line intervention for a panic attack. Remaining with the patient and speaking in a calm, quiet voice can help to escalate the situation. While lorazepam A may be used for severe cases, it is not first line. Seclusion C may increase anxiety. Deep breathing D is helpful, but the nurse's calm presence is the initial priority. Question 12. An epidural hematoma is most commonly associated with which mechanism of injury? Option A. Striking the head on a hard surface. Option B. Rapid deceleration injury. Option C. Injury to the temporal bone with laceration of the middle meningeal artery. Option D. Acceleration minus deceleration injury causing shearing forces. The correct answer is option C. Injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Question 13. A patient is diagnosed with bacterial meningitis. The nurse anticipates the following finding on physical examination. Option A. Positive Kernig's sign. Option B. Positive Homan's sign. Option C. Positive Brzezinski's sign. Option D. Both A and C. The correct answer is option D. Both A and C. Kernig's sign, resistance to passive leg extension with the hip flexed, and Brzezinski's sign, involuntary hip flexion with passive neck flexion, are classic signs of meningeal irritation in bacterial meningitis. Both may be present. Homan's sign, B, is associated with deep vein thrombosis. Question 14. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A. Administer for pain medication. Option B. Obtain a urine sample. Option C. Notify the provider immediately. Option D. Administer antiemetics. The correct answer is option C. Notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 15. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A. Obtain 12-lead ECG within 10 minutes. Option B. Start 2 large-bore 4 lines. Option C. Administer chewable aspirin. Option D. Draw cardiac enzymes. The correct answer is option A. Obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Question 16. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A. Continuous nebulized albuterol. Option B. Oral corticosteroids. Option C. 4-magnesium sulfate. Option D. Immediate intubation. The correct answer is option A. Continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 17. A patient with acute pancreatitis has the following labs. Which finding is most concerning? Option A, elevated serum amylase. Option B, elevated serum lipase. Option C, elevated blood glucose. Option D, decreased serum calcium. The correct answer is option D, decreased serum calcium. Hypocalcemia in acute pancreatitis is a poor prognostic sign. It occurs due to saponification of calcium with fatty acids in necrotic fat tissue. Hypocalcemia can also indicate severe pancreatitis with significant necrosis. While elevated amylase, A, and lipase, B, are diagnostic, they do not indicate severity. Elevated glucose, C, is common but less concerning than hypocalcemia. Question 18. Which nursing intervention is most important for a patient with an ING tube to low intermittent suction? Option A, change the ING tube every 24 hours. Option B, provide frequent mouth care. Option C, maintain the patient in a supine position. Option D, flush the tube every 8 hours with 50 ml of sterile water. The correct answer is option B, provide frequent mouth care. ING tube to suction can cause a dry mouth and sore throat. Frequent mouth care, including oral hygiene and moisturizing lips, is essential. The tube does not need to be changed daily. A. Supine position. C. Increases risk of aspiration. Flushing. D. Depends on hospital policy and should not use large volumes. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with acute pelvic pain, fever, and cervical motion tenderness, chandelier sign. What is the most likely diagnosis? Option A, ectopic pregnancy. Option B, ovarian torsion. Option C, pelvic inflammatory disease. Option D, appendicitis. The correct answer is option C, pelvic inflammatory disease. The classic triad of PID is pelvic pain, fever, and cervical motion tenderness, chandelier sign on bimanual exam. Ectopic pregnancy, A, would present with pain and bleeding but often no fever. Ovarian torsion, B, presents with sudden, severe unilateral pain without cervical tenderness. Appendicitis, D, presents with right lower quadrant pain. Question 20. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B, ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 21. A patient presents with signs of sepsis. Which of the following is the most important early intervention? Option A, administer broad-spectrum antibiotics. Option B, administer 4 fluids. Option C, obtain blood cultures. Option D, start a vasopressor. The correct answer is option C, obtain blood cultures. In sepsis, blood cultures should be obtained before starting antibiotics to identify the causative organism. Antibiotics, A, should be given as soon as possible but after cultures. 4 fluids, B, are given simultaneously with cultures. Vasopressors, D, are started after fluid resuscitation. Question 22. A patient presents with a temperature of 101.4 degrees Fahrenheit, heart rate of 110 beats/min, and respiratory rate of 26 breaths/min. To consider if the patient may have sepsis, the nurse should assess if the patient has Option A, a possible infection. Option B, positive blood cultures. Option C, an immunocompromised state. Option D, been febrile over 24 hours. The correct answer is option A, a possible infection. According to the current definition of sepsis, a patient with signs of infection, fever, tachycardia, tachypnea, should be assessed for a possible source of infection. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Positive blood cultures, B, are not required for diagnosis. Immunocompromised state, C, is a risk factor. Duration of fever, D, is less relevant. Question 23. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A, Staphylococcus aureus. Option B, Pasteurella multocida. Option C, Streptococcus pyogenes. Option D, Bicnella corrodens. The correct answer is option B, Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24–48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Bicnella corrodens, D, is associated with human bites. Question 24. A patient presents with a swollen, painful ankle following a fall. The nurse notes that the patient is unable to bear weight. Which test should be performed to guide the need for X-raise? Option A, Ottawa ankle rules. Option B, pivot shift test. Option C, Lockman test. Option D, McMurray's test. The correct answer is option A, Ottawa ankle rules. The Ottawa ankle rules are clinical decision rules to determine whether X-rays are needed for ankle injuries. Inability to bear weight is one criterion that indicates the need for X-rays. Pivot shift, B, and Lockman, C, test the knee for ACL injury. McMurray's test, D, tests for meniscal injury. Question 25. Which of the following is a priority intervention for a patient with priapism? Option A, administer pain medication. Option B, apply ice to the genital area. Option C, prepare for surgical intervention. Option D, administer oxygen. The correct answer is option C, prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention.